Hi, welcome to the Contra Costa County and Tri-Valley Eldercare channel. My name is Stephanie. I'm the Marketing Director for Horizon Elder Law, as well as today's host for the Contra Costa County Eldercare channel. Today we're here with Dr. Michael Nelson. Welcome, Dr. Nelson.
Thank you.
Dr. Nelson has been practicing in the San Francisco Bay Area since 2002. Dr. Nelson has devoted his life to care for seniors. He's the only local board-certified neurologist who sees and performs house calls. While he has a broad general knowledge of neurology, he has a special interest in dementia and Parkinson's disease. Thanks for joining us.
Thank you for inviting me.
Can you tell our audience a little more about your background and what drove your passion for seniors with Parkinson's and dementia?
Certainly. So it was a process through school, and I originally wanted to help people, and that's still my ultimate goal. And it went from actually law at first to sports medicine to going into medical school, and I knew that I could accomplish that when I actually got an A in Biotin in college, and that I could achieve that goal. And then through medical school, I found that I liked caring for seniors and I wanted to be a specialist. So neurology naturally followed that.
Great. What are some common symptoms of dementia or Alzheimer's?
Well, first I'll explain that dementia is the broad category, kind of like saying that somebody has cancer and then there are different kinds of cancers. So Alzheimer's is a form of dementia. And there's normal forgetfulness, like this morning, I'm sure I forgot a few little things that I wanted to bring. Those are normal. Where are my keys? Those are normal forgetfulness. I've never been to this office before. I did have to use a map. That is normal. But abnormal things that I would consider red flags, are getting lost, particularly in a environment that you're familiar with, and personality changes. So those two are clear warning signs that it's gone from normal forgetfulness to a dementia.
Can you give me an example of personality changes, what that means?
It normally is things that fall under judgment. So if your parent has been tight with money most of their life, and then they're suddenly giving $1,500 to a telemarketer, that would not be an appropriate decision necessarily.
Okay. What should I do if I suspect my loved one is having signs of dementia?
Well, there's a lot of technology coming out to screen for patients and some early forms of detection of dementia. The most important thing is to see your doctor about it. It could be something very simple like a low thyroid or a medication side effect. So it's important to rule out common causes that can be reversible.
Yeah. What are some ways of treating dementia?
There are medications. There's some confusion about memory medications, and I say that word, and really they help cognition and they help slow down worsening of how your brain works. The confusion is that there's some opinion that they don't help over the long term, and as a neurologist what I've seen is that it slows down the worsening over as long as you're taking it. It is hard to know if one individual patient is benefiting from the treatment, but the studies and all the information support the use of memory medications.
Great. So, do you have any suggestions for helping caregivers understand the disease better to provide more adequate care?
That's a great question. So, as a neurologist, medically there are limited choices, and they don't completely cure the disease. So the caregivers are also the ones that suffer from the disease itself. So education of the caregiver is super important, and also ensuring the health of the caregiver is very important. And that can include a great resource, which is the Alzheimer's Association. They have an excellent website, and they even have a hotline that you can call 24 hours a day, 7 days a week, which is to me just amazing. So educating the caregiver on normal changes, what to expect, what they can help and can't help, and also making sure that they have proper supports and that they don't get to the point where they can't handle it anymore and then it's a crisis. And usually those crises could have been averted.
Absolutely. And I know they have some adult day services that help with just giving caregivers respite and socializing and things like that also. So in your opinion, is there some genetic component to this disease?
Well, I get that question a lot, and it's normally as a concerned family member that is worried about getting it themselves. It is generally a low risk. So it has much more to do with your lifestyle, meaning if you smoke or have high blood pressure or cholesterol, those vascular risk factors are much more an important risk of getting dementia or Alzheimer's than a genetic component. And that includes vascular dementia, Alzheimer's, Lewy body. There is one specific one called frontotemporal dementia, and that one is more likely to have a genetic component and earlier onset, say in the 50s, which would be very unusual for Alzheimer's. But overall, there is not a large component of genetics.
Well, that's good to know. It's such a sad disease.
I agree.
Probably everyone has dealt with somebody in their life that's been affected by some form of Alzheimer's. So is there anything that can be done to prevent dementia?
Another great question, and yes, so to reassure family members, again, that if they have a loved one that has it and they're worried about getting it themselves, the two main areas are physical exercise and mental exercise. The physical exercise plays into those vascular risk factors, so it lowers your blood pressure, your cholesterol, reduces your chance of a heart attack or stroke. That is much more logical, but now there's more information about keeping your brain active. For example, early retirement is a risk factor for dementia, and that supports the ongoing need to keep your mind busy. There are products on the internet now that help keep your brain trained, but I generally recommend to patients to learn new things. A brand new thing is the most helpful than rather doing your 1,000th crossword puzzle.
Yeah, I've heard that also. That's good advice. So now I've recently heard that you co-founded a company called Memento. Can you tell us a little more about that?
Certainly. So my wife and I have cared for seniors. She's under spectrum and hospice, and over the process of going and seeing patients in their homes and in board and care facilities, that we realized that particularly in board and cares, there is a lot of variability in the quality, and also there's a general lack of information about board and care homes that's out there. So we founded Memento to improve the lives of seniors living in board and care homes. And we accomplished that goal by bringing in services that normally aren't found in a board and care home. We provide reassurance to family members that there's satisfaction surveys and other mechanisms to ensure quality. And so besides being able to help individual patients as I do as a neurologist, I can improve the lives of seniors in board and care homes on a much grander scale through Memento.
Well, that's wonderful. Well, thanks for sharing, and thank you for your time.
You're welcome. Thanks for inviting me.
Yeah, it's been really nice to learn more about what your tips are on dementia and some of your feedback on that. If your loved one would like more information about Dr. Nelson or Memento, you can find all of his contact information on his main page on the Eldercare channel, including a link to his website, or you can call him directly at 925-954-4572. Thank you for watching the Eldercare channel. We hope you have a wonderful day.